Factors that influence ethical behavior. A child's development in the way they socialize with others is affected by what they are being taught at home, at school, in and around the community. Children tend to form an attachment to those that bring positive impacts in their life, and this allows that child to retain that knowledge and pass on what they have learned to others. Due to the extensive research and understanding of what is to be considered normal or abnormal behavior and development, we must keep in mind that our environment and social surroundings can have a long and lasting effect on our lives as individuals. In regards to the microsystem, this system focuses on various influences such as school, family, the community in which people live in, friends, and possibly even employment. Knowing how an individual comes together or mix with these examples and knowing what kind of influence all of these groups had on an individual deals with the microsystem. The microsystem focuses on a direct impact of an effect on an individual. The mesosystem refers to the type of connection and extent of communication that the individual has with all those involved. The exosystem involves any kind of social activity that the individual does not have a direct established relationship with, and tie that together with the day-to-day relationships and communication of those that are already involved in someone's life. An example of this would include a child making numerous friends at their current school but find out that they have to move due to their parents' job changing. This may cause conflict to arise, which can result in negative communication barriers with that child trying to adapt to new surroundings and make new friends. When it comes to the microsystem, this involves the cultural development in which an individual lives. Eventually, a job, school, and even a community become what is considered a cultural group once a relationship is established enough to adapt. In regards to the chronosystem, this involves the transitioning of certain life events that tend to affect an individual over a drawn-out period of time. For example, when a child experiences the death of a close sibling, going through the transition of learning to adjust to not having that person around anymore may be a hard learning process that can hinder that child from moving forward with their life and strike some feelings of anger and uneasiness. Furthermore, each of these systems have a way of figuring the psychological development of an individual. Tourette syndrome, also known as TS, is a classical neuropsychiatric disorder shaped by genetic and environmental factors, which has been investigated extensively in the last 2 decades. However, children with TS are often underdiagnosed and misdiagnosed because of the lack of education and awareness of the wide range of indicators and symptoms of the disorder. In regards to the person-environment perspective, better known as the PI perspective, this primarily focuses on how learning to balance your life is vital and learning to find ways to adjust to the ways of the environment in which you have become accustomed as you progress in age. There will always come a time in all of our lives where we may need help or may be of help to someone else, whether it be advice from a friend, a shoulder to cry on, seeking professional help, or finding a coping mechanism of dealing with the everyday stressors of life. The company you keep, the activities you engage in daily, the way you communicate with others can all stem from various environmental factors. Bronfenbrenner's ecological theory shows among people and the subsequent benefits of social support. For example, an inviting space with the comfortable chairs and privacy can be encouraged to a family to stay and visit with a patient. The environment can influence people's behavior and motivation to act. For example, a dingy corridor filled with extra hospital equipment, excuse me. For example, a dingy corridor filled with extra hospital equipment will invite staff to leave another item in the hall, whereas a clean corridor and adequate storage will encourage staff to take the time to put the item away. The rooms with bright light, natural light, and artificial can improve health outcomes such as depression, agitation, and sleep. Bronfenbrenner's ecological theory consists of how an individual develops and depends on certain environmental factors such as the microsystem, mesosystem, exosystem, macrosystem, and the chronosystem have an effect on the individual stages of an individual. A biopsychosocial approach to the treatment of depression involves biological, psychological, and sociological dimensions. Hormones and genetic predispositions are considered important biological factors to examine. Coping strategies and decision-making processes might be important psychological factors, and a history of trauma